In this, the third video in the Healthy Living series, we take a closer look at cardiovascular disease or CVD, better known as heart disease. Let's look at the following forms that cardiovascular disease can take, namely, firstly coronary artery disease (CAD) and ischemic heart disease (IHD). The arteries that supply blood to the heart muscle are known as coronary arteries. When these arteries harden and become narrow as a result of fatty deposits on the inside lining of the vessel walls, coronary artery disease (CAD) occurs. These fatty deposits increase gradually, further narrowing the arteries and reducing blood flow to the muscle of the heart, depriving the heart muscle of oxygen, leading to ischemic heart disease (IHD) and damage to the heart muscle. Secondly, angina. Angina refers to pain in the left side of the chest which occurs on exertion such as walking up the stairs, when coronary vessels are partially blocked, restricting oxygen supply to the heart as a result of restricted blood flow to the heart muscle. It manifests itself as chest pain or discomfort which may spread to the jaw, neck, shoulders, arms or to the back. It is aggravated by exercise or emotional pain. Angina is an indication of the existence of atherosclerosis, plaque buildup, in the coronary vessels. The term is also used when there is a suspected heart attack but hospital tests do not reveal damage to the heart muscle on the electrocardiogram (ECG) or blood enzyme tests. Doctors perform an ECG or stress ECG, which involves walking on a treadmill, to confirm the diagnosis. If angina is confirmed, it is important to be closely monitored and that the correct medication is taken. Thirdly, let's look at atherosclerosis. Atherosclerosis is the hardening and narrowing of the arteries caused by a slow buildup of plaque on the inside walls of the arteries. It is a slow progressive disease that may eventually impede blood flow to the arteries of the brain, heart, kidneys and arms and legs, or in a worse situation may block the flow of blood to these organs. In the fourth place, let's look at cardiomyopathy. Cardiomyopathy is the disease of the heart muscle, which becomes enlarged, thick or rigid, causing the heart to be ineffective in pumping blood to the whole body. Number 5, let's look at rheumatic heart disease, RHD. It is a condition in which the heart valves have been permanently damaged by rheumatic fever. The heart valve damage may start shortly after untreated or undertreated streptococcal infections such as strep throat or scarlet fever. An immune response causes an inflammatory condition in the body which can result in ongoing valve damage. Causes of RHD. Rheumatic heart disease is caused by rheumatic fever, an inflammatory disease that can affect many connective tissues, especially in the heart, joints, skin, or brain. The heart valves can be inflamed and become scarred over time. This can result in narrowing or leaking of the heart valve, making it harder for the heart to function normally. This may take years to develop and can result in heart failure. Rheumatic fever can occur at any age, but usually occurs in children aged 5 to 15 years old. It's rare in developed countries like the United States but common in developing countries. Untreated or undertreated strep infections can increase the risk for rheumatic heart disease. Children who get repeated strep throat infections are at the most risk for rheumatic fever and rheumatic heart disease. In the next article we will be looking at risk factors for heart disease and who is at risk of developing heart disease. These series of videos are not intended to be a complete medical advice, but are intended to raise awareness to these medical conditions. In the event of any symptoms related to what we discussed herein, please do not hesitate to seek proper medical advice from your doctor as some of these conditions may be life-threatening. Please like and subscribe to our YouTube channel and we will notify you whenever more of these videos are released. Please also leave us your comments below with your tips on how we can improve these presentations. Thank you once again for watching. See you again soon.